Welcome to Emergency Insights. I'm your host, James Carter. Today we're discussing a practical and efficient troubleshooting method for Foley catheter dysfunction. As healthcare providers, we've all encountered situations where a patient's Foley is not draining properly. A patient might be anuric despite having a catheter in place, or they may be experiencing suprapubic pain. Before jumping to a new catheter, consider reaching for your POCUS machine. Point-of-care ultrasound offers a quick, non-invasive way to diagnose the problem at the bedside. To begin, grab a curvilinear probe and place it over the suprapubic region. You can get a transverse view of the bladder by orienting the marker toward the patient's right side. Alternatively, for a sagittal view, simply orient the marker toward the patient's head. The goal is to first assess the bladder's state of fill. In a properly functioning Foley, the bladder will be decompressed. It may appear as a small, empty space, and you might even be able to visualize the Foley balloon itself. Now, what if the bladder is distended? This suggests either an obstruction or a malposition of the catheter. The next critical step is to look for the Foley balloon. If you scan the bladder and do not see the characteristic circular balloon structure within it, this is a strong indicator that the catheter is not in the correct position. In this scenario, the appropriate course of action would be to deflate the balloon and attempt to advance the catheter to a more optimal position within the bladder. Beyond simple malposition, POCUS can also help identify the nature of an obstruction. For instance, you might see debris within the catheter lumen or in the bladder itself. In a patient with hematuria, you might notice heterogeneous material that is effectively clotting off the catheter. If the obstruction is due to a small amount of debris, a simple flush might clear the issue. However, if the patient has significant hematuria, a simple two-way Foley may be insufficient. POCUS can guide your decision to replace the catheter with a three-way catheter, enabling continuous bladder irrigation to manage the bleeding and prevent further clotting. Using POCUS in this way allows us to quickly pinpoint the problem, leading to a more targeted and effective intervention, saving time and reducing patient discomfort. That's all the time we have for today. Thank you for listening, and we'll see you next time.